So primary care is the foundation of internal medicine, the heart and soul of it, if you will. We're not here just about preventative medicine or diagnosing diseases. We're here to build trust, and we have the privilege of walking alongside our patients at every step of the way. At our community clinic, we serve a diverse and sometimes a socially disadvantaged population. We teach our residents about diagnoses and the management of medical conditions and guidelines, but more importantly, we teach them how to build trust, how to advocate for their patients, and resilience. We are committed to high-quality care, even if we're in a resource-limited setting. We want our residents to look at primary care as a calling, as a way of life, because it's meaningful, deeply impactful, and profoundly human.
I think it's the wonderful opportunity to interact with the patients and have a long-term relationship. I love when I come back to the clinic and I see my patients and they're like, "Hi, Nana," and they're like telling me about their stories, their days, their work. It makes me feel much more involved in the patient themselves, and it makes me help realize that it's not just the symptoms that we're treating, but the persons themselves.
Like when a resident is being trained in this type of environment, it will definitely help you for your growth. Because definitely when you have like everything at your disposition, you may be limited in some point. But when you think outside the box, it will be very helpful because it will guide you and it will build you as a big resident, also as a good doctor.
I think it's super important for residents to train in a resource-limited environment because it sharpens you as a physician.
Practicing in this environment helps us being more critical, creative, and then it forces us to think about how to allocate these limited healthcare resources.
It makes you think, it makes you rely more on your clinical judgment and physical exam way more than just reflexively ordering tests and imaging and all of that.
It's important for the residents to train in a resource-limited environment because of the realities of medicine. They can recommend a certain course of care, certain medications, but if the patient is unable to access that financially or otherwise, then we're not going to get anywhere. And it really makes a difference for the outcome for the patients and also for the learning of the residents.
You learn the skills also of a thorough history and physical. If you don't have a thorough history and physical, the rest of it can't be built. You have to do that in a very focused way on the inpatient side. On the primary care side, it's focused, but you learn to expand it as appropriate.
The most important thing that I learned in this clinic is that good medicine is not really about making good diagnoses. It's also about understanding the patient and their life context and how we're able to provide care that is feasible but also very sustainable.
We are not just dealing with the diagnosis, but we are also dealing with the social issues, which is the reality the patient faces. Right? It's not just about prescribing medicines, but it's about, can they afford the medicines? What are the barriers for them to take the medicines, and how can I advocate them?
It's very important to understand what is behind all this, to figure out what are their abilities, are they able to take care of themselves, provide the resources. We have a social worker here who helps us a lot in these cases, and it makes us appreciate the life more and the meaning of the quality of life when treating those patients.